To properly assess blood pressure, you will need a blood pressure cuff, also known as a sphygmomanometer, and a stethoscope. Prior to taking blood pressure, you must be sure of a few key points. 1. The patient must be sitting upright in a resting position with feet flat on the floor, arms resting on a flat surface such as a table, and back supported. 2. Patient must refrain from smoking and caffeine consumption at least 30 minutes prior to taking their blood pressure. You must choose an appropriate sized blood pressure cuff and select a properly working stethoscope. Not doing so will alter the results. Once all proper tools are chosen, you are to firmly wrap the cuff around the upper arm, aligning the indicators to the brachial artery. Be sure the cuff is not too loose on the patient's arm to avoid any misreadings. Be sure the cuff is firmly wrapped around heart level. Before placing the ear tips in your ears, hold the headset in front of you with the ear tubes pointing away. You may now put on the appropriate stethoscope and gently tap the chest piece to confirm that it works. Adjust your position or the position of the gauge so you can clearly see the reading. You will next place the face of the chest piece of the stethoscope right on the antecubital space over the brachial artery just below the cuff. And go. You may now inflate the cuff to about 200 millimeters of mercury and gradually release the pressure in the cuff at about 2 to 5 millimeters of mercury per second. As the air is being released from the cuff, listen with the stethoscope and observe the gauge. The first beat sound will be the subject's systolic pressure. The last beat sound you hear will be the diastolic pressure. Once both numbers are obtained, release the remaining air in the cuff and record your reading. Once you have completed the first blood pressure measurement, repeat the process a minute after to ensure accurate results. Normal blood pressure is less than 120 millimeters of mercury systolic and less than 80 millimeters of mercury diastolic. Prehypertensive is between 120 to 139 millimeters of mercury systolic or 80 to 89 millimeters of mercury diastolic. Stage 1 hypertension is 140 to 159 millimeters of mercury systolic and 90 to 99 millimeters of mercury diastolic. Stage 2 hypertension is anything greater than 160 millimeters of mercury systolic or anything greater than 100 millimeters of mercury diastolic.